Learning management systems for healthcare. A learning management system is a web-based software application that stores and manages learning content, facilitates instructor-to-student and student-to-student interactions, processes and records assessments, generates reporting, and tracks learner activities. In addition to enabling an organization or institution to deploy training efficiently through an e-learning platform, sharing educational resources, assessing learner performance, and providing collaborative spaces electronically, the purpose of an LMS is to reduce and streamline technological, accessibility, and financial barriers associated with training. Implementing a learning management system is a complex, multi-phase process that begins with reviewing and assessing several LMSs as part of the selection phase. There are a myriad of LMS platforms available free or at cost, catering to an array of industries. Several are designed with features that support specific training requirements for healthcare organizations. However, despite the hundreds of LMS software options, there is no such thing as a perfect LMS. Before reviewing and selecting an LMS, major considerations should be addressed. Usability, accessibility, support, and cost are four of the most primary concerns when selecting an LMS. Usability. Usability refers to ease of use for LMS administrators, instructors, and learners. Usability also entails an attractive and user-friendly interface and back-end controls. Interfacing with an LMS should be intuitive so that users aren't required to complete countless tutorials to perform and access basic functions. Accessibility. When it comes to accessibility, users of an LMS should be able to access training and resources through most mobile devices using most web browsers without experiencing prolonged periods of downtime. On the back end, an LMS should be compatible with e-learning authoring tools such as Storyline and Captivate. Support. LMS administrators should have reliable and speedy access to vendor support during and after integration and vendor assistance in ensuring long-term viability. Cost. Cost of implementation, ownership, updates, and maintenance should be made clear upfront to ensure funding sustainability. For healthcare organizations, there are additional factors that should be considered when selecting an LMS. A healthcare LMS should be able to support the complex organizational hierarchies inherent in large-scale institutions. It should be able to track learner or clinician recertifications and competencies. An LMS should be able to generate customizable reporting and analytics in order to support regulatory inspections and audits, as well as business goals and planning. An LMS should be able to integrate with other systems such as human resources information systems and electronic medical records, as well as integrate with third-party vendors. Lastly, an e-commerce functionality would be useful, as several training requires payment from non-employees such as contractors. One of the most popular learning management systems used in healthcare is Centerline Health Systems. Customized solutions and a flexible platform are the hallmarks of this LMS. It is a cloud-based product but also has the malleability to be hosted on a client server with tailored learner and instructor interfaces. Clients receive general online support as well as product training via documentation, webinars, in-person training, and a free demo. The Centerline LMS contains the architecture to support large-scale healthcare providers and can be configured to support specific organizational requirements such as recertification and competency tracking, reporting and analytics, other systems integration, and e-commerce. Its primary features are usability, flexibility, manageability, and scalability. HealthStream is another LMS that supports 3 million active users, such as Christus Health and Avera St. Anthony's Hospital. It was created with healthcare needs in mind and hosts 20,000 medical e-courses that are accessed by numerous healthcare providers. It is a cloud-based system with online support during standard business hours. It was designed for complex and expanding organizational hierarchies, recertification and competency tracking, and flexible reporting and analytics. Being a third-party vendor as well as an LMS, HealthStream pioneered system integration and contains advanced e-commerce capabilities. Cytent Propel LMS is another popular LMS that has been adopted by several healthcare organizations, such as the American Heart Association and CardioVillage. Propel is a cloud-based LMS that combines LMS technology and business services with e-commerce capability. For over 20 years, Propel eLearning has provided expertise in instructional design, LMS technology, sales, marketing, and customer support. Their specialty is in the healthcare industry and deploying certified and credentialed training. Here's a side-by-side comparison of the three learning management systems. There are several advantages and disadvantages that distinguish each of these LMSs. Centerline Health Systems is cloud, SaaS, and web supported with an option for the LMS to be hosted on an organization server. This LMS is designed specifically for healthcare. Since pricing isn't publicized, a prospective client would need to contact Centerline for a baseline quote. If the quote is outside an organization's training budget, time and resources to obtain this information could be wasted. HealthStream has an advantage of 20,000 pre-built e-courses that many healthcare systems access. Like the Centerline LMS, HealthStream was designed for healthcare organizations. As a disadvantage, it also doesn't advertise pricing, which could indicate a high fee and out of the budgetary range of some organizations. In addition, HealthStream has limited customization as a disadvantage. Cytent Propel is also designed for healthcare organizations. Compared to other large-scale LMS platforms, it has a lower one-time cost and no individual licensing fees. Although Propel has no distinguishable disadvantages, in order to effectively assess all three LMSs, a trial use or sandbox where clients can test each system would be the best evaluative tool to determine if an LMS would meet the needs of a healthcare organization. An LMS provides solutions that streamline organizational training, processes, and business goals. Evaluating what LMS would be the most suitable for an organization pivots on defining organizational learning needs and researching the LMS options that can best meet those needs.